I'm so sorry. Can you hear me?
Yeah, that's better.
Yeah.
We got the.
Sorry, start without me anyway. I'm in the background. We'll make up your 1 minute, Ben. But over to you.
Yeah. Okay. Thanks, Pete. Yeah. Just before I start, I think Pete, we work closely with the Yorkshire and Humber AHSN, and Pete very kindly invited me along here to give a bit of a snapshot of clinic healthcare solutions. We're coming at this from the perspective as we are the digital front door for general practice, and we're able to triage patients to physio services, whether that be an internal physiotherapist or a first contact physio, or a digital physio service. And we're more than happy to work with digital physio services in specific areas, so we're open for collaboration in that respect. So yeah, thanks for being here, and without further ado, I'll share my screen and crack on with some slides. Okay, can you see my slides?
Yes.
We can, yeah.
Brilliant. So yeah, our mission is to ensure that we see the right patient at the right time with the right resource, and ensure that if possible, we can efficiently redirect them into relevant pathways if they do not need to see a GP. So our purpose is that we want to help healthcare providers cope with the increasing demand with the same or less resource in a less stressful way. Our plan is that clinics triage and patient flow management solution optimizes general practice and urgent care capacity, and reducing unnecessary GP appointments and improving patient access. So a little bit about ourselves. We were established in 2013 in Finland by a team of doctors and engineers with leading expertise on how patient pathways should be arranged in order to deliver high quality care and cost effective processes. They designed an intelligent AI triage and patient flow management solution, and our company now has a presence in Finland, Portugal, the UK and the Netherlands. With that said, Clinic has been deployed in over 500 healthcare centres in Finland and the UK combined, and more than 2.4 million patients have access to our product. In the UK specifically, more than 150 practices have joined Clinic, and we have approximately 1.3 million patients that are able to access our product in the UK. So just a little bit about the implementation of Clinic. Our goal is that we want to put general practice in control of their patient flow. The main elements of our solution are: one, an intuitive total triage platform handling clinical and non-clinical inquiries coming through online, the telephone and walk-ins. We provide an online platform for patients to submit their inquiry, but also provide a telephone module for care navigation teams to take the inquiry through the same system. Following that, there are two main flows. The medical inquiries go through the algorithm, Clinic's online triage module, while they can also create customizable workflows that can create different types of inquiries that can be linked directly to the relevant team or resource in the practice. The algorithm automatically recognizes over 1,000 symptoms and condition, and can identify the primary care issue and recognizes its urgency, which can be used in the practice interface to prioritize a response. It can also recognize symptoms that are suitable for self-care, in which case, in the near future, the patient will be directed to the relevant articles using the NHS A to Z, directing the patient away from the platform. On top of this, and crucially for this session, on top of the self-care advice, the system can create efficient redirection possibilities for main conditions like MSK, mental health, and inquiries to the pharmacy. And finally, we're piloting an automated redirection to out-of-hours services based on the time of day and urgency. For the creation of intelligent network, we like to connect our system to the wider healthcare network and support the integration of the AAR roles within PCNs. So within this process, you'll see here that we are the front door for general practice in terms of the patient's digital journey. So we have a dynamic symptom checker where patients can enter their age, date of birth, and sex. And based on that, we have a dynamic symptom cloud that asks some questions about their ailment. And this creates, on the practice side, a working diagnosis based on time, urgency, gender, and age. And we can create redirection possibilities of this in our redirection engine. So this maps services and based on inputs and organizational configurations. And with that, we can highlight symptoms that are suitable for MSK, mental health, and we're working with NHS England to look at community pharmacy services. So where we've brought this project to life, or in the process of bringing this project to life, is around North Lincolnshire CCG, where we're working with 2 of the 4 PCNs within that area to create the digital front door, where patients can input their symptoms. Our AI engine recognizes the symptoms and gives an urgency detection. And for non-urgent responses, we can categorize that as MSK, and the call handler or the duty team on the practice side can direct patients to their physio service, whether that's a first contact physio, whether that's a referral into a secondary care or a community physio, or whether that's a referral into a digital physio provider, depending on how their local pathway is set up. I just wanted to further explain to why customers are using Clinic. First of all, it's about the experience. So both from a patient side and a practice side, we have an intuitive system that's easy to use and can result in significant time saving within the practice, and the ability to redirect patients into the right pathway very simply. We take a good patient history taking. So the way we collect information from the patient at that digital front door of general practice is akin to good patient history taking. And also the GP capacity. We know that we can help practices identify which cases need to see a GP and which cases can be redirected into other areas. And so we're utilising the full skill set of the healthcare practitioners within a GP practice. Appreciate that's a very quick overview of our product and quite general, but if you have any questions, I'm happy to take them now.
Well, we'll take 1 or 2, because I made it that you started at about 47 minutes past, so I'm going to go to our next at 56, 57, so a couple of minutes. There is one question just around what type of AI is embedded within Clinic from Andrew Cuff. So yeah, if you wouldn't mind just.
So yeah, I'm not an AI expert, but we use a Bayesian logic or a statistical analysis. So basically, every time a patient enters a new system, the system basically calculates all the inputs plus the new input. So it's looking at the whole set of inputs. So it's not a decision tree type algorithm.
Lovely. I'll tell you what we'll do, because people can post questions, but if we get sidetracked a little bit with too many, we'll lose track of time. So I think if it's okay, I'm going to hand over to Healthcare Comms, because clearly today we need a little bit of extra time on our side just to get presentations up. So Ben, thank you for that. One of the things I wanted people to do just while we go to our next speaker is, yeah, please put your details. So if anyone's interested in the work that you're doing, we know how to connect. But yeah, if that's okay, I'll hand over to Healthcare Comms, please. And if you could stop sharing your screen a second, Ben.
Oh yeah, sorry.
Thank you. We're all looking at little widgets of ourselves.
Is that better?
Which when it's hot and sweaty is not great.
Yeah.
Great stuff. Thanks, Pete. I'm hoping now that we can.
Perfect. Yeah, we're on.
We're all on. Great stuff. Well, I'll try and get things back on track in terms of timing. So good afternoon all. Really pleased that you've joined us this afternoon. By way of brief introductions, I'm Mark Broughton, Head of Commercial for Patient Pathway Services at Healthcare.
And I'm Concepta Wayment, Vice President of Transformation, also at Healthcare.
So we'll give you a quick guide through our approach and art of the possible to patient engagement across the MSK pathway. Just for a little bit of background in terms of healthcare communications and who we are, we provide a patient engagement platform working with over 130 trusts across the UK, delivering over 150 million patient communications year on year. Sort of more locally within the region, we've got a very strong presence and footprint, as you can see from the slide on screen. And that sort of has enabled us to establish strong engagement both with trust in the region, but also with patients, providing a real solid foundation to drive further innovation at scale within MSK across the region. And within our own, sort of product stack and product portfolio, where we'd look to deliver enhancements and innovation, we're also seeing our role within that as an enabler to develop more of an ecosystem, particularly with some of the other great products that you're going to see today, as sort of Pete touched on earlier in his introduction as well, but also to support trusts and patients in enhancing their journey through an MSK pathway. So.
Thanks, Mark. Our patient engagement platform, as Mark has said, enables us to take MSK patients through their individual pathway, either digitally or, importantly, non-digitally too, based on your patient's preference or their ability. We can do this ourselves or by collaborating with a partner, such as one of the many innovators you're hearing from today. And a great example of this is single point of access, where we currently are collaborating with a partner to offer patients slightly further north in your region, actually, access to carers, appointments and advice through a digital front door. We touch all elements across the pathway, as you can see. In terms of referrals management, there's a real opportunity to begin engaging with patients early through sending out, for example, patient activation measure questionnaires to establish not only the effect of their condition on their daily life, but how engaged they're actually likely to be with their trust, which will then directly impact on their health outcome. Additionally, waiting list management has a long-term place in operational management. The impact, obviously, on COVID has exacerbated that, but generally the impact on service and general managers' workloads is immense. So automating that as an ongoing process really improves the patient experience, but frees up, importantly, quite a lot of that operational time. From referral management right through outpatients, surgery, and of course even diagnostics, all three areas that patients will travel through on their journey typically, we engage right across that pathway, right through to discharge, where we can handle not only discharge monitoring, but also, importantly for MSK, PROMs and PREMs. And these, of course, then link back full circle to the patient activation measures at referral stage. You can see how we can really join up the patient's journey through MSK across multiple channels, digital and non-digital, to suit patients, work flexibly with other providers to create a real ecosystem that can provide value to both the trust and the patients. I'm sure you're wondering what that might look like. I'm going to hand back to Mark so that he can show you how we can deliver on that.
So thanks, Seb. So just to give some sort of visual samples and examples of the solutions that we can deliver. When we talk around sort of advice and guidance, we've got some great agnostic technologies and chatbots and the like that can really enable patients to self-serve relevant and appropriate information. And those bots can include direct responses to questions that are being asked, or can signpost out to specialist online resources or websites, links to video resources. For example, if you're going through a physio pathway and there's some exercises that you've been given to do, part and parcel of some of the FAQs or guidance that you could provide could be around, links to videos that show you how to do specific exercises and so on and so forth. Those can therefore be surfaced and accessed via your website, social media channels, through voice and call deflections, and any other means and touch points where patients are able to access your services. You can sort of start using bots to support that self-serve aspect of things. From an appointment management perspective, it's a real data-driven digital first correspondence platform. Patients are sent an SMS notification to invite them to access their letters and the correspondence digitally. It's an optional facility to create their own account to collate all correspondence in one single place if they choose to go down that route. But from an appointment letters perspective, they include response options to confirm, cancel and rebook, either through semi-manual processes or fully automated. There's maps to their appointment location, and clinic-specific information and resources can be linked through and mapped at clinic level. Patients are able to filter by correspondence type, appointments and non-appointment correspondence for past, current or cancelled appointments. We have inclusivity tools built into the browser, so that supports language translation. There's over 100 languages now built into the platform, 40 of which are provided with audio. You've got screen masking and audio visual tools to support patients with regards to that accessibility. In addition to sort of your general correspondence I touched on earlier around the collation of questionnaires and surveys, we have an e-forms module that supports the digital collection of that sort of engagement feedback from patients, supporting those patient access measures and proms or triaging, etc. The key to this as well is that we do seamlessly support non-digital communications. You know, it was touched on earlier that not all patients are able or willing to engage digitally. So we have a sort of an integrated soft failover to print and mail where those patients do or cannot go digital. In terms of appointment scheduling, you know, whether that's via the portal or via appointment reminders or even via patient initiated contact, we can support that fully automated approach to rescheduling. So with your PAS or EPR system, where we've got access to APIs, we can offer this as a real-time interaction with patients. The example shown is an SMS interaction, but it enables patients, once they've stipulated that they want to rebook their appointment, the API calls that are being made will search for clinics of the same type and category in order to then present back options for them to select a future appointment date and then available slots within that appointment. And utilising that sort of API basis, we can in real time then automatically book that appointment in. There are other options available outside of APIs if that's not available, such as robotic process automation and such like. But at the end of the day, it's around working with individual organisations to determine what solution and approach would be best for yourselves. And I touched on there, you know, patients being able to initiate that process as well. So you could potentially have, as an example, using that sort of SMS conversational approach, a dedicated shortcode that's publicised on websites, social media, and so on and so forth.
PIFU is another approach, patient-initiated follow-ups, that trusts might currently use manually, usually by a CNS picking up answer phone messages and calling those patients back in some kind of priority order. By automating that process, you empower those suitable cohorts of patients and may well then free up the valuable time of CNSs to take on other important work. These can be accessed for patients either via our portal with all of the tools Mark has mentioned, or as you can see on the right hand side, using an incoming SMS which comes into a virtual assistant who asks those same triage questions that a CNS would ask. In this particular instance, the patient sends a shortcode in and then begins interacting with the virtual assistant. It's important to note that the content of the questions is absolutely set by consultants. The virtual assistant gathers that information, as you can see, conversationally, meaning a great experience for patients. On the right hand side, you can see there it's very quick to use. It feels very conversational. It uses tap, not type technology, so it's very quick for a patient to engage with, particularly if a patient is feeling poorly, for example. Also, the results are presented to the Trust in real time. It's obviously much quicker for a CNS or another member of the clinical team to read a page of results rather than have 20 repetitive phone calls asking the same questions. This also means that patients can get help as soon as it's needed and be booked into an appointment for those that are in crisis and do need to see somebody very quickly.
Just a last 30-second warning, please, if that's okay.
Thank you. We're just done.
Right on point. So no, thank you for your time. If you'd like to speak to us further or have any further questions around anything that you've seen today, please contact either myself or contact me directly. Contact details are there on screen, and I'm sure Pete will ask us to forward on slides to be distributed later.
Yeah, I'm sure we will, because that very, very polished slide deck. Next up is Physitrac. I mean, I will try and make sure I give equal balance in my comments to all. So I just wanted to say to Ben at Clinic, I'm a big fan of Northlink CCG because I used to work there. So I'm always looking at work that they're doing. I know a lot of the GPs there. So this is why the companies that I've selected today, they're all sort of handpicked. So Clinic, Northlinks. I know you've got some comments in the chat about connecting. Really well polished. I mean, I said at the beginning, didn't I, about how I like things that are simple, clean in design, and healthcare comms. You look like you've done a great job of that. And Browser Loud we use on our cardiovascular website, a project that I've been leading on for the last 2 or 3 years. So lovely to see that in there. So thank you for that. Hand over to Physitrac, and yeah, lovely.
Well, thanks, Pete.
Thank you, Pete. So hello and welcome to Physitrac, the world leader and game changer in remote patient engagement. Thank you to Pete for the invitation for us to showcase how Physitrac can be successfully integrated into MSK pathways to help improve patient outcomes and reduce system pressures in the NHS. My name is Tom Gray, and my background is working clinically as an MSK physiotherapist. I have a wealth of NHS experience, so I'm well accustomed to the challenges that our profession faces and how change, innovation and adaptation are constantly needed to help drive us forwards. I'm here to demonstrate how Physitrac is the perfect tech solution to achieve our shared goals of connecting the health and social care systems through technology and transforming the way patients' care is delivered at home and in the community and in hospital. I also have my colleague, Frank van Zon, on the call. Frank is a trained physiotherapist in the Netherlands and is our head of business development at Physitrac. We'll both be glad to take any questions that you may have following this presentation. You will find QR codes throughout to take you straight to some of the resources mentioned, and Frank will be posting the relevant links in the chat function. We're happy to share these slides with you afterwards upon request. So who are Physitrac? Physitrac is a public limited company, and we specialise in providing tech solutions to healthcare services with the ultimate aim of saving precious and valuable time, both from a clinician and patient perspective, as well as providing a fantastic experience to boost outcomes and satisfaction. We deliver a cloud-based software as a service to over 250,000 healthcare practitioners across more than 180 countries and to in excess of 2 million patients per year, to a total of 30 million plus users. We currently work with over 50 large and internationally recognised NHS trusts across the UK. We also work with other large healthcare providers in the UK, such as Bupa, Nuffield, Connect Health and Circle, including BMI Lincoln and BMI Huddersfield in your local area. Our core Physitrac solution is a database of more than 10,000 high-quality, studio-produced and physiotherapist-written exercises, which are voice-over narrated, a vast library of evidence-based educational material, and licensed patient-reported outcome measures that can easily be prescribed to patients to complete anytime and anywhere, thus removing several barriers that MSK services commonly face in achieving optimal care and patient outcomes. This sets us apart from our competitors. Physitrac is available via web browser and from the Apple and Google Play stores, and even on the Apple Watch. We were founded in 2012 and are therefore a tried and tested mature company with a rich portfolio of real-world success stories and case studies for validation. Our platform is also evidence-based, having featured in multiple published journals to demonstrate our worth of improving home exercise adherence for people with musculoskeletal conditions and reducing the number of required face-to-face contacts. Physitrac was also the virtual physiotherapy platform provider of choice for telehealth and exercise prescription in the recent Ascenti study, in which 92% of patients were satisfied with the effectiveness of virtual treatment. In 2020, Guy's and St Thomas's performed an impact study using Physitrac and concluded that our software improves patient experience and engagement with clinicians and improves service outcomes in an MSK department. They've also prescribed more than 21,000 exercise programs across their 150 licensed practitioners via Physitrac. St George's Hospital also performed a Physitrac APP in 2016 and concluded that Physitrac was well received, with tailored interventions showing elevated outcomes in terms of patient experience, clinicians' time to care, exercise replication and patient confidence. Physitrac also opened up and enabled new ways of working, facilitating both patient access and seamless support, while simultaneously increasing productivity and efficiency gains. And motivation and uptake was hugely positive across a range of specialities. Our technology empowers the patient to feel confident in how to achieve optimal rehabilitation from initial injury all the way through to return to full function, and in the self-management of long-term and recurrent conditions. We've received excellent feedback from patient users that Physitrac is like having a physiotherapist in your pocket. This is achieved through creating actual and perceived consistent contact between therapist and patient. Our tool not only supports patients in completing their rehabilitation, but also in giving them a voice in reporting their outcomes and logging their activity. Physitrac therefore supports the patient journey through each step of the MSK pathway. So how does Physitrac integrate seamlessly into an MSK service? So let's start at the beginning with the referral. Physitrac comes with telehealth. This allows you to conduct a virtual triage assessment with a patient via the Physitrac platform, thus reducing the number of software that a clinician needs to have open at any one time. Connect Health have reported that through pre-appointment telehealth, 20% of their referrals do not end up needing face-to-face intervention and can therefore be discharged for self-management using Physitrac. It's also worth noting at this stage that we offer an auto intake function prior to this step. The patient then attends a face-to-face appointment with the clinician, more prepared, having already started their rehab journey in advance. If not already done so, the clinician can then set the patient up with their program of exercise, education and outcome measures using the patient's name and year of birth. The patient then receives instructions to access their program via the patient-facing platform known as PhysiApp. They can set notifications to be reminded to complete their exercises and follow their program in real time. Our remote patient monitoring enables the clinician to collect data on exercise completion and adherence, real-time visual analog scale reporting and outcome measure results. The latter can be prescribed to be completed at set intervals by the clinician. This gives face-to-face and virtual follow-up appointments more value, where the clinician can really dig deep into the patient's progress and identify potential barriers that may be inhibiting optimal recovery. This can also be performed remotely, reducing the need for follow-up quick check appointments, and is perfectly aligned to equip you with all the tools needed to enable remote management, especially in the COVID-19 pandemic. We also offer Physi Data. This bolt-on allows practice managers to perform cohort analysis of collected data to help prove service impact and support the securement of funding, as well as identifying training needs. We have been an Apple Global Mobility Partner since 2016, meaning Apple designers and engineers helped Physitrac to develop our user interfaces and user experiences to ensure high levels of usability and the most up-to-date standards and technology. However, we know it's not all about the capability of the technology, it's about what problem it is trying to fix. And therefore, this ensures that our software is highly time efficient, thus having a natural savings implication to help streamline a clinician's daily workflow. Physitrac is fully customizable. You can add your own exercises, education material and outcome measures, which you can then catalogue to fit within your own library under your own personal accounts. You can also add your own NHS Trust's logo to the clinician and patient-facing platforms to increase brand association and to add a personal touch. We were part of the NHS Accelerator programme and in the first cohort of the NHS Digital Health programme in 2016. We also feature in the aforementioned NHS MSK Digital Playbook and have a wealth of anecdotal examples of how Physitrac supports the other key priorities, including self-management, supporting patient discharge, and supporting patient-initiated follow-up after discharge. Physitrac Direct is our accompanying platform for services with more than one license. It is here that a self-delegated lead admin can manage your team's licenses, track user activity, enable patient sharing across your team, share content with your staff, and brand your practitioner and clinician-facing interfaces. We understand that time is extremely precious in the NHS and that the integration of new technology can often require an investment in this. We also know that people see transformation as hard and difficult to manage, as reflected in the Green Health study in 2020. So we have produced the free Physitrac Level 1 and 2 certificates to mitigate this. Clinicians can work Clinicians can work through a series of video tutorials to help to get to grips with the key software features and functions, and to ensure that your workforce is getting the most out of your investment. Physitrac is also fully scalable and is designed to be just as time efficient for 100+ users as it is for one. We also identify another challenge with integrating a new technology software within the NHS is the rightly stringent information governance processes in relation to GDPR. We have a dedicated information security management team who can support you in completion of any requested paperwork. We've achieved DTAC status and we meet all of the standards required by Data Security and Protection Toolkit.
Last 30 seconds, please, Tom.
Thank you. Our servers are also UK based and run as sides in London. We also integrate with a number of recognisable systems that you already potentially used, such as Patient Knows Best and System 1. So what does Physitrac cost? So our pricing structure is competitive and is based on health economic modelling that demonstrates a return of investment. We offer a heavy 33% discount for NHS trusts at a rate of £7.99 per clinician. And we also offer a free 3-week full access pilot, which will extend to 6 weeks for today's attendees. And you can scan the QR code on the screen to take to that now. I'll just wrap things up by stating that Physitrac is effective, scalable and innovative. And if you'd like to ask any further questions, we would also urge you to apply for NHSX funding through the QR link on the screen or any other funding channels. You can contact me directly by scanning that QR code, which will send me an email with your question.
Lovely, thank you, Tom. And you know, that's perfect, because as I said, I want to comment just very briefly on each of you. Again, another clean, crisp product. What I like is what you just said at the end, the collaboration that you're doing with other innovators, and I did mention that at the beginning of the event, and also the HSN try and offer innovators a bit of help to help them access the NHS and how to navigate the NHS. And one of my areas, we don't get involved in pricing models, but being transparent on your pricing model, I think that is fundamental. And at the end, you did that. So thank you for that. Brilliant presentation. Let's keep moving through them, please, if that's okay. I'm going to hand over to Daff at Concentric Health, and yeah, we're on time.
Perfect. Hi all. So I'm going to share this screen, which can you see? No. Maybe you can just see my.
Yes, we can, Daff. Yeah.
Can you?
That was a picture of you on a walk, not now though.
Yeah, I know. It was full screen, and then it. What can you see now? No.
Here we go. Give it time. There we go. It's you on a walk.
Yeah, it shouldn't be. It should be. It should be a slide.
Yeah.
Give me a second. I'm just going to minimize that window and do it with a small way.
We'll try one more time, and if not, I might hand over to.
Is that better?
Yeah, brilliant. We're on. Good to go.
Window rather than screen. So hi all. So I'm essentially going to walk through a demo of Concentric and digital consent, and just to kind of introduce the concept of digital consent to you as a mechanism of supporting remote pre-op pathways. So very quickly, I'm Dav. I was a surgeon by training, now leading Concentric Health, and I've been in health tech for the last 6 years or so, in a couple of different companies before having the opportunity to run with Concentric. So although this session is mainly around the MSK funding, in parallel there is some NHSX peri-op funding that has a focus on digital consent and digital pre-op assessment, with the kind of main focus on accelerating elective recovery. There are lots of reasons why you would introduce digital consent for lots of different people, but in terms of that funding, that's what it's kind of trying to look to do. And I think over the last year or so, we've got to a point where there are a few products in both of those spaces, which are now, can genuinely be introduced and, are worth looking at, noting that there's a few of the guys from IDO on the call, which is one of the other options in the consent space. So from a Concentric perspective, so this is a proven product, trusted across the NHS now. So lots of our work initially was in London, Imperial, Chelsea, but now used across a number of other places, and Calder and Huddersfield in the region have just tendered for Concentric and are about to introduce over the next 4 to 6 weeks. But essentially, this is a platform to introduce a digital remote consent process, makes it really easy to share personalised information, and ultimately to support informed shared decisions. I'm going to walk through a demo so you can kind of see it in action, the things to kind of look out for. is that we make it really easy to kind of allow you to combine things, personalize as much as you need to, so that basically moving towards digital consent by default for anything that you would usually use a written consent form for, you know, there's carbon copy yellow consent forms, you know, within a number of weeks within the trust to shift to digital consent by default. And we're really proud of the experience and how intuitive that is. So all integrated into systems. We do our deployments through with EMIS Health. So they you know, come in with our experienced delivery team to support us as a startup who move quickly and develop really lovely products. So I'm going to walk through a demo, which hopefully you can see. So this is a demo. You're not going to see any real patient data. This is me as a clinician logged in. I can kind of filter episodes, search for episodes. If I go into a patient. So as a clinician, I can search for a patient. I see their consent history. I can go into any of these and see details, or I can create a new episode. This is a really powerful search bar, so I can search for, you know, any procedures that I want to, synonyms, combinations, you know, whatever I want to do. I can create combine episodes, bring templates through. Let's do a total knee replacement, given that we're talking about MSK stuff. So as a clinician, I select the procedure that the patient's going to have, and all of the different kind of bits around this consent process and the complexities around different consent form types and all that kind of stuff is managed within platform, changes what it needs, all the things you'd expect. And then what you have here is a template for that procedure. So this is used, you know, across all procedures, all specialties. So this is just one template for a total knee replacement. And most of the time as a clinician, I can quickly select off this template, but I've got the flexibility to add, you know, whatever I want to, rich content, no coded content that I can add in, or, you know, add notes about things, you know, staging or x-ray findings and all that kind of stuff. All this becomes visible to the patient as well. And even things that Concentric doesn't know about. So, you know, as a clinician, I can add something completely custom in. Same in terms of alternatives. So I can kind of select off template, sharing anesthetic options with patients, and then the risk profile. So this is the kind of complications that may occur from an operation. Most of the time I'll select all risks. But again, the same principles. I can deselect things that aren't relevant to the patient, customize these. So this might be a high risk patient. I might say, actually, this is common. And I can add other things in, you know, whatever I want to do. So we can customize this information as much or as little as we need to for that patient. All of the core information that's required in terms of platform sits within Concentric, but we also then direct out to other things in terms of, you know, trusted external sources, you know, Royal Colleges, you know, videos, animations, all this kind of different stuff. And then in terms of additional consents, so you know, here's a total knee replacement example. So things like consent for National Joint Registry is relevant, and any other kind of associated consents, which are often, you know, research trials, all that kind of stuff will be baked into platform. So then as a clinician, you've selected the relevant things. You can go into consult view. This takes whatever you've selected, presents it in a lay-facing way and structures the conversation between clinician and patient. All of these will have descriptions, links out to other things, and is also exactly what patients have access to in their own time from home. You know, all these are options that they can come back to as many times as they want to, pre-op, but also post-op, and you know, they'll come back and see the risk profile, for example, after, and say, well, actually, you know, should I be expecting these complications and that kind of stuff. So historically, you'd have had a long list of medical terms on a consent form. Here we have, you know, context, when, how likely, what it might mean for the patient, and anything that I've changed, you know, bespoke on that previous page comes through to here, as it were. In terms of Montgomery and material risks and the kind of legal position around here, so also make it really easy to add notes, document the conversation, and all of that is visible to patients as well. Links out to other things, national, local, you know, local leaflets will often get added here. And then most of the time we will see patients being shared this information to go through the information remotely. This might be alongside a video consult, or increasingly alongside kind of voice calls, and then sending information out. You know, their email, mobile number will come through, and you can state whether you're happy for patients to give their consent remotely in their own time. In terms of the consent flow, what that looks like is like this. So you have the consent statements, and any of these additional consents, so things like National Joint Registry documented within platform. And then signing, so this knows I'm on a desktop, don't have a touchscreen on this device, gives me a QR code. Either patient or clinician points their phone at that QR and signs on there. Or if I'm on a touchscreen, I sign on screen, sends that information to the patient, generates a PDF on the day of surgery, often on clinicians' own devices. They'll kind of find the episode, confirm consent with the patient, document any conversation, questions, anything like that. And then PDF will get generated, sent into the EHR. So we integrate with all these different EHRs for demographics and pushing documents in and all that kind of stuff. And then most of the time in theatre, this PDF is just brought up in that EHR as part of the WHO checklist. So that is a whistle-stop tour through product, and I'm happy to take any questions.
Lovely, thanks for that, Daph. I've been following the chat a little bit. I don't know if there's any comments in the chat. I don't think there is, not a latest one, but again, just in case people, we're all right just for a minute. Yeah, I mean, Daph and Concentric Health, another company that I've known of for a good sort of 12, 15 months. It feels a bit band or obvious with certainly across all specialties, but musculoskeletal and trauma orthopedics and spinal. I can only imagine the amount of procedures that are happening under local and general anaesthetic that need the consent process. So yeah, very, very nice product, Daph, and very much part of that MSK pathway, as it is of many other pathways. Okay, we'll keep moving on, and yeah, we have got time because we don't have to be back into the main room until 4, so we will be able to grab a quick drink after this. But I'm going to hand over to MedXnote, if that's okay, and Niall Rafferty.
Thanks, Pete. So, can everybody hear me? Okay, I'm just waiting for the loading presentation to load up.
Yeah, it's coming through.
Okay.
Yeah, there we go. Okay. You're up.
Okay, so I'll just grab a pointer as well. If I can get one first. Okay. So everybody, it's great to speak to you all today at this event. Just a bit of background, I'm calling in from Ireland, so we're based in Dublin. We have an office in Leeds, and I was a radiographer who trained in the NHS, so I was NHS trained radiographer, did a lot of work in PACS and risk systems, set up MedXnote out of really to solve the problem of internal communication in hospitals. We've been part of the GDE program, which I'll talk about in a minute, and now we're kind of branching out into new ICS workflows across trust workflows. So we'll talk about this. So really what we've done so far has been proven in the acute setting, and now we're branching out into the wider clinical pathways. So this is all new to us. So the plan for today is just to show you what we do in acute care and then show some of the initial use cases we have for cross ICS workflow. So I'll just move through this. So right now at the moment, MedXnote, we're in the middle here. So we're leveraging Microsoft Teams. So everybody, 1.4 million people in the NHS have access to Microsoft Teams. And we connect clinical systems like your EMR, radiology system, your lab system into Teams. Not just Teams, but Microsoft Planner, Microsoft Shift, any of the Microsoft 365 stack. So and we've got 2 apps in the Microsoft Teams App Store. So these are apps that we're probably the only provider that are accredited by Microsoft to have applications running on Teams. So Teams has its own app store, kind of like the Apple iPhone store. You can develop apps for that, and you can add them into Teams. So these apps are embedded in Teams. So we have 2. MedXnote MT was the first one, which we refer to as the bot. I'll show you some use cases on that. And then Planner is our new one. So that's kind of more got to do with pathways and task management. In terms of hospitals we're working with in the NHS, Southampton was our first hospital. That was through the GDE program. Obviously, then we got Hampshire Hospitals as part of a GDE fast follower. We've now got Portsmouth Hospital as well as a new hospital, and working in France. So we started up in France in Nancy Hospital in the northwest or northeast of France as well. So we got 4 hospitals. So we're a young, growing company. So just to show you then what the bot does in terms of how it works. You've got channel notifications are very popular, and what these are, I'll show you some examples here. So if you can see here, you got COVID-19 alert. So really what we're doing, this is Microsoft Teams. This is the mobile version of Teams. and we can plug in channels. So you can create channels for COVID-19 alerts, and we can plug that into the integration engine in the hospital, so that if you're a neurologist, if any of your patients have a positive or negative COVID result, the result would come in here. So similarly for flu can go in there and alert. So you're kind of defining the alert when the event happens. It's pre-sent to into a channel in Teams. Just as a bit of a lag, sorry. Okay, so I just need to go back. Sorry, there's just a little. It's a little bit laggy, the presentation. So in terms of you get the notification. Or the other thing we do then is bots. So with the bot workflow, what you're doing is you're interacting with a bot in terms of you're putting in a chart number in here. You're clicking on the send button. It comes back with the demographics straight away. You can look up pathology, radiology results. When that result happens, you get notified in Microsoft Teams. You can view the results securely in Teams. You can acknowledge it back to the originating system. So that's very popular in terms of having a bot to interact with data in the hospital. So you can say to the bot, "Where's my patient?" The bot will come back, "Your patient's on ward 4, unit 1, all that kind of stuff. So the other thing we can do then with bots is you can upload data. So you can take images using the bot, and you can store these images to clinical systems like the PAC system, etc., and different clinical systems. So then really, if you think about, that's kind of the three main things we do in hospitals: notifications to channels and Teams like the COVID results, interactive bots to ask the bot for information, so give me the latest results on pathology or radiology, and then using Medic's note bot on Microsoft Teams to upload images. So then when we move into wider then outside of that, some of the projects we're doing, so Southwest Hands Connect project, it's connecting GPs in the Hampshire region to doctors in Southampton Hospital. So this was our first kind of this is still not live. This is where we see it happening, but or where we see the use cases. So we're working on this project at the moment. And what happens here is that Southwest Hands Connect, they're not sure of the clinical pathway in about 20% of cases. They have a portal, so you need to discuss the patient. You need to discuss with a specialist. I'm not sure of my options. They have their own portal, but really what they want to do is feed that into Medic's Note, and then the options are, the patient can stay at home, they can access community services, they can access speciality directly, or they can go access the emergency department. So what we did was for that we created a process in Microsoft Teams where in Teams, if you look, this might be hard to see, but this is called a message extension in Teams. So if you imagine all the GPs have Teams, they can access the message extension at the bottom in the chat window. This is Medic's Planner here. This is what we call it. It'll open up this screen here, and you can add a task. So if you do all that, then we created this form, if you like. So not sure a pathway, need advice, put the clinical details here. You submit it, and then that goes into the hospital doctor's workflow. So if you imagine that was a GP in the Hampshire region looking for advice and guidance. So now you're a doctor in Hampshire Hospital, and you want to see how you receive that alert. So what happens with them is they have this planner board here, what you can see. So you can have Southwest Hands pathway unknown. GP. This is a message that's come in just from the GP. So Southwest Hands GP, patient's name, NHS number. When they click on that, it can open up full screen. Most of the time, hospital doctors will be looking at it on their mobile phone. So this is actually Microsoft Planner. So Planner is a task management tool that comes with 365, either on the national tenant or the local tenant. And what we're doing, I suppose, and everything we do is we're making these tools that come with Microsoft 365 clinical tools. So here the doctor gets the alert to Microsoft Planner, they have a consult request, or they open it up. So pathway, this would be where your pathway unknown advice is needed here. And then the doctor can look at the task, and then when they're free, then you can use the power of Teams to either call the doctor back, you can do a video call, or you can just text. You could have a text-based message. So again, we're leveraging all the facilities, the power of 365 Microsoft Teams. We're adding that clinical layer on top of it. So then the other workflow then, GPs and podiatrists, diabetic foot ulcers for again, Hampshire hospitals. So this one is two parts to it. So one part we're going to give the GP the Medic's Note bot. So like what I showed you earlier that we do in hospitals, they'll be able to use Microsoft Teams, take an image of a patient in the GP surgery. So take an image of their foot here, so this diabetic foot ulcer, and they'll be able to send that in to a hospital doctor for advice and guidance. So on the hospital doctor side, so you've got a diabetic doctor working in the hospital. So again, they will get notified into the planner board. So this is Microsoft Planner. So this is your urgent diabetic foot consultation card comes in here. You can open that up. Just open it up now. And then you can see the card, like, you know, diabetic foot advice, the date. I have a complex patient with a diabetic foot. There's the details. Can you review it? And then you can open up the image here. So effectively what we've done is we've mapped all these fields out. So, you know, clinical systems can send information into them in Microsoft Planner. Again, it looks great on mobile. So, you know, these are the 4 mobile screenshots. So again, mostly hospital GPs will be on PCs, laptops, hospital doctors, every iPhone or Android phone. So you've got urgent diabetic foot advice coming in from a GP. Open it up, you can see all the details there. You can see there's an image. You can open up the image, you can view it, and then the GP can choose to either, you know, they can phone the doctor back using Microsoft Teams. They can have a call, like we're having a call here in Microsoft Teams, or they can text the doctor back saying that looks really bad. You need to bring them to A&E immediately, or whatever the outcome is. So that's kind of how we're imagining, I suppose, our role in terms of a clinical pathway. So it's all very new. These are 2 examples that we think are pilot examples that will be our first pilots. We're looking for maybe somebody in the audience has a pathway that wants to leverage what we do, leverage the power of Microsoft Teams. So we figured out technically how to do cross ICS workflow. And I think I'm out of time, but I'll just show you the last slide. So the last slide then, it's just show you that we're on the Microsoft Teams App Store. So if you're on Microsoft Teams, if you look, there's an App Store at the bottom left-hand corner here, and then you'll find Medix Note there. We have a little demo on the App Store, but so if you can install Medix Note, it'll install it on the left-hand side over here, and you can actually play with it. It's a very simple demo, talks you through it. You can put in a chart number to come back with a patient, but it just gives you a flavour of what we do, what an app in Microsoft Teams is, and how you can actually enhance Microsoft Teams.
Lovely.
So that's the presentation. Thank you.
It's very kind of it. Yeah, and oh, I've got an echo here somehow.
Well, I'll stop.
Thank you. Yeah, I mean, you know, we're right in the heart now of workflow, automation, other parts of that digital pathway that are highlighted. And, you know, what pricks my ears up about technology like this is, you know, you're trying to maximize existing systems and I like that. I think the push and pull for clinical systems is essential. And it's just nice to show people what's possible using technology that, yeah, probably more of us are getting familiar with Teams. There was a question in the chat about, you know, people's access to Teams, but if it's all right, Niall, if you can pick that up outside of this, I think other people that have spoken today don't have that sort of same issue, but certainly yeah. I'm aware that Teams is getting maximised across trust for a range of reasons. Okay, we'll keep
1.4 million users in the NHS are licensed for Teams, so everybody's licensed for Teams 365, so it is there. So it's just a matter of activating it, I suppose.
Absolutely. Good. Okay, we'll hand over to Tommy at KeyActive if that's okay.
Thanks, Pete. Let me just bring up my slideshow. So hopefully you can see that.
We can indeed, yeah.
Okay, perfect. So I am Tommy Parker, CEO at KeyActive. So KeyActive is a digital therapy focused on making people's everyday physical activity an accessible and effective medicine for improving health, long-term condition management and rehabilitation. Our personalized technology enabled service is clinically proven to deliver sustainable behavior change and improve people's self-care without the need to visit clinics or gyms. Has no barriers to age or mobility and is proven to engage hard to reach groups and be effective in areas of deprivation. A key focus for us is that optimizing the benefits of physical activity is about understanding that every move we make matters, and our approach expands the therapy window from just a few hours of exercise per week to include all 112 waking hours, enabling people to discover the opportunities to move more within the context of their health, capacity and environment outside of the typical rehabilitation settings. We also recognise that physical activity, and in particular everyday physical activity, has multiple dimensions, each of which is independently important to health. And this view enables us to capture all aspects of someone's physical activity, whether it's dancing around the kitchen while the kettle's boiling, impacting on their non-sedentary time, gardening, giving them moderate activity, or going for a walk, counting towards their moderate bouts. So when we look at physical activity and making physical activity a medicine within these pathways, we're focused on its scientific definition as any bodily movement produced by skeletal muscles that results in energy expenditure. And so because of that, we're measuring physical activity as the energy expended through movement every minute of the day. We determine the relative intensity of that movement in each minute by using metabolic equivalents, and that helps us to provide a very personalized picture of the intensity and duration of people's everyday lifestyle. And what we do, capturing that with a wearable monitor, is put that through our algorithms. So we have developed a patented method for analysis that ensures that the data is accurate, complete, and representative, which is a really crucial step for making physical activity data meaningful and actionable in the context of healthcare, preventing detrimental behavior change by presenting people with the wrong picture. So this more personalized and comprehensive view of the individual's activity provides more bespoke options for behavior change and also an accurate assessment of its impact. And by giving people the time and enabling them to choose activities that work for them, that fit into their lifestyles, we can empower them to create sustainable habits that benefit their health, quality of life, longevity, without prescription or compulsion. And this has quite a big impact in terms of its accessibility. We're focused on underpinning our behavior change with self-determination theory. The theory suggests that it relies on people understanding the value of the behavior that they're taking part in, knowing how to implement that change, so how to choose the right activities for them, and also to feel supported in their authentic self-choice in doing so. So within our service, we've shown that this can be accessible to all age ranges and people of various different mobilities. And I think this quote from one of our users, which is an NHS referral, really highlights how that behavior change has been underpinned by this new understanding. She said, I feel more aware of how movement impacts on my everyday life and how developing a planned increase in my movement improves my mood, my strength, and my motivation. Even small changes have noticeable effects, which have encouraged me to build on this start that Key Active has given me. Basically, Key Active has changed my life. So in terms of how it works, we analyze physical activity data from a validated wearable, as I mentioned earlier, across the multiple dimensions using our patented method. And this enables us to display accurate and actionable data in the personalized online dashboard immediately, so that the user can use that to make better decisions about their health. The dashboard is available 24/7, incorporates clinically proven behavior change techniques, and we then provide telephone support by a trained mentor at key times during the first 12 weeks to help the user to gain confidence to plan, monitor, and improve. And this is what that support looks like across the 12 weeks. So what we found is that this new personal understanding enables people to have the tools to make self-endorsed behavior change driven by their intrinsic motivations. So within the context of the NHS pathways, we deliver this on a simple one-off per patient license fee that includes all of the technology, all of the mentoring side, but also enables users to continue their self-monitoring as they get to keep all of the access to the technology after the initial 12 weeks. We've demonstrated our measurable impact across multiple health conditions, and this has been recognised at a local and national level, most recently becoming a fellow on the NHS Innovation Accelerator. And in terms of our data, by establishing this comprehensive picture of the net impact of an individual's behaviour across 24/7, we're enabling an accurate measurement of the health impact and also can provide clear evidence in terms of benefit to all stakeholders. We've helped thousands of people to improve their self-care through everyday physical activity, and the reported benefits that you can see on the left-hand side have been achieved. And I think the comments on the right hand side again just show and slanted towards this MSK group how we can impact on people's mobility and their strength by using everyday physical activity and increasing people's awareness of physical activity outside of that typical exercise or clinic environment. Across the group, we've demonstrated a completion rate of 88%. 96% of people have improved their physical activity and 79% have improved in 4 or more of the dimensions that we've talked about. The device has been worn for 91%, so in terms of data collection, there's a great engagement, and 76% of people have continued to use it after the 12 weeks, with 95% of people recommending it to family or friends. And again, I just wanted to show very quickly some examples within our work. So this is actually from some referral pathways for long-term conditions where they've had other musculoskeletal complaints, but we are now also accepting referrals through MSK pathways. So I think the one with lower back pain, highlights quite a typical use case where we've enabled people to understand that lots of their movement can count, but also I draw attention to the one on the right hand side, which said I did a lot of work on one day and now my back hurts. I'm doing it now in smaller blocks. I wouldn't have done it before and I would have just stopped. So again, being empowered to know that they can choose how to do their activity in different ways has enabled them to actually, rather than stopping completely, continue to manage it on their own.
Last 30 seconds, please, Tommy.
That's all right, Pete. And so in terms of the knee replacement, again, very similar outcomes, and we're also operating in a number of kind of perioperative pathways for prehab and rehab too. So to find out more, please visit the website and email me at the address. I'll also pop it in the chat box so that we can continue our discussions, hopefully. So thank you very much for your time.
Yeah, lovely and great feedback and vitally important. Kerry, I'm going to hand over to you next with Get You Better. We've got, if I can give you sort of 10 minutes, it'll give us 2 minutes just for a comfort break before we go back into the main area. But thank you again for that, Tommy. Just on mute, but we can see your screen.
Can you see my screen there?
It looks perfect. So yeah, off you go.
Thank you very much. My name is Dr. Carey McLennan. I'm the CEO and founder of Get You Better. I'm also a physiotherapist and a researcher, so I do boundary span a bit. And Get You Better provides digital self-management of all common musculoskeletal injuries and conditions across an integrated care system. The solution is integrated, locally configured, providing digitally enabled MSK pathways. Now, we provide self-management for all common musculoskeletal injuries and conditions, including back and leg, neck, knee, shoulder, upper limb, lower limb. We'll soon be having pelvic health pathways as well. And it's designed to support not just recurrent or long-term conditions, but new injuries such as an ankle sprain or recurrent joint or muscle problems. And we take the national guidelines, we work with the organisations to configure the pathways and content locally, and then it is provided to patients and they are connected to their local self-management pathways. And this is done either via prescription or self-referral. And our platform integrates and can update the patient records, but also automate referrals the whole way across the system. And it can be used to provide support to 80% of all primary care MSK patients, including GP, first contact physiotherapist, physiotherapy patients, and those that are on waiting lists. It's not designed for those requiring targeted physio or medical management. Now, we've got 3 types of pathway in our system. A condition pathway, which provides the lived experience of that condition from the moment it happens right the way through to 2 years. And our platform can build these clever algorithms for that. It provides targeted self-management, responds to patients' recovery, provides physical, mental, social and behaviour change methodologies. We have a rules and recommendations engine, and it is the whole pathway journey. So that is the lived experience of the patient. That is then connected with the clinical pathways, and they're national pathways for conditions that are standardized across a region such as an integrated care system, but then configured and delivered locally. For example, in one of our integrated care systems, South West London Partnership, Wandsworth, Kingston, Sutton, Merton, Croydon, and Richmond all have different area pathways that can be delivered to the patients in those areas whilst adhering to regional standards. And it's quick to update. Then we include the healthcare pathways, which are connecting patients when it matters, either through outcome measures, stratification tools, and automating referral. So promoting self-management across the whole pathway, but connecting patients when needed. And this is 3 areas. It's the healthcare system, such as emergency department, GP, physio or rehab, or the social care, prevention and well-being, or public health. And it is condition specific, so the access patients get differs between whatever musculoskeletal condition they have. Now, our aim at Get You Better is to provide true local self-management support to help patients trust their recovery and have the confidence to use less healthcare resource. And this is a whole pathway approach to self-management. So it's not just about triage or exercises, it's a whole pathway approach. Triage, including ongoing symptom monitoring, recovery day by day from day 1 through to 2 years, referrals into the system to physio, to the emergency department, to 111, connection with local rehab and long-term condition programs, such as escape pain, prevention and well-being if somebody's better, supporting reoccurrence episodes because musculoskeletal conditions reoccur, but also finally supporting patients to optimize their time on waiting lists, and also PIFU, patient-initiated follow-up. This is just an example of how we work. So we deploy and integrate into primary care, including all the local services, including the physio services, and connect patients to the local programs. We also deploy in the urgent care system, so patients that seek soft tissue or musculoskeletal help in emergency departments can also get access to their local apps. And also in secondary care, supporting the orthopaedic clinics. We also are working with NHS at the moment to support carers to deliver care to their patients. By providing this whole pathway approach, we are able to increase digital diversity, reduce digital exclusion, and reduce carbon footprint by supporting patients to not actually need to go in, getting access to their pathways at home. We do have a rapid deployment model which we work, and typically we can go across an integrated care system in about 4 months. And patients are connected in 4 ways to their local pathways: via desktop icon that's pre-installed to all clinicians, via text message, via e-consult, or crucially, self-referral via a website 24/7. We are evidence-based, and this is really important to Get You Better. We're a certified medical device. We have a full NICE digital health technology evaluation done by an academic health science network, the HIN. We've got behavioural change science in our solution. All the content is designed to support behaviour change, and that's done with the University of the West of England. We've done a full economic evaluation. We are 91%. We are in the Auckland Library. We are DTAC compliant, and we are, and you can, as an example, on the NHS playbook. There are realisable benefits that we can draw on. So we can support up to 1 in 10 patients across a whole population with musculoskeletal problems, and we're doing that in London. Cost benefit ratio: for every £1 you spend, you'll make a saving of 3.48. We can reduce physiotherapy referrals by 20%, reduce GP appointments by 13%, crucially reduce prescriptions for musculoskeletal conditions by 50%, prescribe digitally, not pharmacologically, and we can demonstrate behaviour change. And 86% of patients would recommend to the family and friends. 73% felt the app provides a better GP service, but none disagreed. And all patients felt the app would help their recovery. We're working with lots of different people. We're working with NHSX on care homes. We're on the digital playbooks. We're currently in cohort 5 of the London Digital Health Accelerator. We're working with 3 or 4 academic health science networks around the country. We have contracts in PCNs, in CCGs and integrated care systems across London, Bristol, etc. And we have a good working network of academic partners for our evidence. So thank you very much for listening. I don't know how long that has been, and would really like to hear from anybody that would like to hear more or just has any questions about our solution. So thank you very much.
Lovely, Kerry. Thank you for that. You had minutes to spare as well, and but that's probably minutes that people can maybe just go and grab a quick comfort break before we go into the main room. Just before we do that, I wanted to say thank you to everyone, and I always feel a bit guilty when you put the order together, and I'm thinking, it's been a long day already, it's hot, but for you to go at the end, Kerry,